All right. I think we'll get underway. And so, as people join us online, I just want to welcome everyone for joining us today. And as we are adapting to many, many changes by the hour, this discussion is quite appropriately a look at the recent Ontario election and specifically what it's going to mean for healthcare in the province. And we will also talk about the possible effects on tariffs, whether they're on or off, because 5 minutes ago they might be off. Anyways, we'll try and discuss that as well today. So we will be taking your questions later in the program. The team today consists of me as your host, the esteemed Nick Nanos, who you know is the king of data. Hello, Nick. To Michael Ceci, advisor on the provincial health for Santis, and Patrick Nelson. One housekeeping thing that I've forgotten. We will be taking your questions, and those will be able to be submitted at the bottom using the Q&A function. So please put it in if you want to direct it to one of the guests. Please do so. We're going to have slides that go through each of the presentations. And we will have a survey at the end of the webinar. So we appreciate any feedback on how Santis can make these better. So let's now go to Patrick Nelson, the manager and partner of Santis Health, for a few words. Patrick.
Thanks so much, Avis, and thank you for moderating this important discussion for us. I also want to thank Nick for partnering with us through this. We appreciate your time, Nick. And lastly, a big thanks to the team behind the scenes, Haley, Dylan, Mariana, who you won't see, but they've done a lot of the legwork to pull this together. So thank you to them. So shameless plug for Santis. If you didn't know, we are Canadian owned and operated. We've always been proud of that, but for some obvious reasons, we're pleased to sing it from the rooftops more and more. We now have a team of 60 professionals and experts spread right across the country from British Columbia to Atlantic Canada. Our clients benefit from our experience and depth in health and life sciences, but also from the expertise in our three defined service areas: communications, government affairs, and management consulting. Thanks for joining us today, and we look forward to your questions at the end.
Great. Thank you, Patrick. Never has a Canadian brand been so important. I have 2 Canadian flags on my house. Anyways, let's start with Nick Nanos, who, as you all know, is with Nanos Polling, and he is going to take a look at things. Over to you, Nick.
Thanks a lot, Avis. So really happy to join everyone and to unpack the Ontario election. I've got some data to walk through in terms of some observations on the issue front and the tracking and on leadership. And then I also want to do a little bit of a regional dive in terms of what happened and what explains what I'll say the seat count. Because, you know, the thing is that the pollsters always focus on, you know, the percentage support that each of the parties garner, but the reality is what really matters is how that converts into seats. I think I do have a PowerPoint, so if we could maybe go to the second slide on my PowerPoint that kind of unpacks the top issues of concern. You know, the thing is as Avis knows, and is my PowerPoint being shared? Or yes?
Yes, it is. Yep.
So as Avis knows, there's a difference between what politicians want to talk about and what voters want to talk about. And you know what? Sometimes they come together in terms of politicians talking about the issues that average voters are concerned about, and sometimes they don't. Now, what's very clear in this particular election is that Doug Ford, the leader of the Progressive Conservatives in Ontario, wanted to talk about Trump. It was kind of like the election. His opponent was Donald Trump. He was responding to Donald Trump every day. He went to Washington in order to kind of advance Ontarians' interests on Donald Trump. And it was pretty clear that what he wanted, at least, was to focus on the contrast and his activities related to Donald Trump. But check out the numbers in the survey when we ask average Ontarians what the most important issue that will influence their vote or what they wanted to hear about. It wasn't Trump. Actually, that was the third most important issue. The top issue was healthcare at 28%, followed by the economy at 22%, dealing with US President Trump at 14%. What does this mean? that if the parties were parties that decided to talk about issues that voters were interested in, they'd all be talking about healthcare. And then they'd be talking about the economy. And then after that, Donald Trump and dealing with, with him. And I think, maybe one of the key takeaways from here is that now that the election is over, even though Ontarians wanted to have some substantive discussions about healthcare, the reality is this is the unspoken issue that has not been dealt with. And I think for all of the provincial parties, I think the reality is this is the question that has not been answered. What is our vision for healthcare? What is our plan for healthcare? How are we going to move forward on healthcare? And yes, jobs in the economy is important. Dealing with the Americans are important, as is housing and taxes and education. But the thing is healthcare really kind of outpaces things. And just as context, many times education, because that's a provincial responsibility, is at the top of the list. Healthcare is 7 times more important than education, right? And Ontarians are still worried about all of those things. But what I want to put on the table is that we had an election about a topic that Doug Ford wanted to have. He succeeded in having an election about that, and his opponents succeeded in kind of allowing him to focus on that. So healthcare, still a big question mark that Ontarians want to hear from all of the provincial party leaders. And the thing is that when we unpack, if we go to the next slide, if we unpack, the views on this generationally and by demographics, you can see that, even for younger Ontarians, it's basically factoring the margin of error. It's a statistical tie between healthcare and the economy. So to think that this is just an issue for older individuals is not the case. It is actually tied for the top, or is absolutely the top issue for basically every demographic cohort. But when we unpack the ballot numbers, if we can go to the ballot tracking slide, the reality is that Ford asked for a stronger mandate, and when you look at the support that he garnered back in 2022, about 41%. So, he started off above what he garnered in 2022, and he managed to maintain some sort of positive delta above that 41% throughout the whole of the campaign, where he finished with 43. The other thing is that in the last election, as everyone knows, the New Democrats and the Liberals in popular support were statistically tied. But what you see is a significant increase or improvement in the proportion of the number of Ontarians that decided to vote Liberal. The other thing is, and I'll get into this, how the New Democrats took lemons and made it into lemonades. Maybe that's another way to describe it, because the number or the proportion of Ontarians that supported the New Democrats noticeably down, 5 percentage points. However, when you convert that into seats, an excellent showing. So we're going to have to give a tip of the hat to the Orange team in terms of how they managed to kind of take the environment and move things forward in a positive way for the NDP. On the preferred premier front, whether it had to do with the leaders debate, the platform, all the stuff that happened, what's clear is that neither of the two opposition leaders were able to land any sort of punch. I think a lot of it had to do because of Ford's focus on Trump. Like the vulnerability for Ford was not on Trump. It was on, why don't we just say, more vulnerabilities on almost everything else. Whether it was defending his record since 2022, putting a focus on healthcare and what's happened in the last number of years, through to kind of, the green belt and all that stuff. So, you can see he got off pretty light. Compared to most, didn't have to defend his record. It wasn't a referendum on him, and he managed to kind of cruise through. But let's take for a second, kind of unpack, if we can move to the next slide, which kind of looks at a number of the different regions. And I want to put a spotlight on the percentage vote and the number of seats that it yielded. And this is really where we get into clarity, what I'll say, how efficient and effective both the Progressive Conservative and the New Democrats were. Eastern Ontario was actually the best region for the Liberals in terms of converting into seats. You can see they had 38% support, and they converted into 38% of the seats. So that was actually, Eastern Ontario was pretty good. But, you know, when we start to go through all of the other regions, Toronto, for example, the vote value in Toronto, you can see both the progressive conservatives and the Liberals punching above their weight, with you know, the Liberals receiving 10% fewer seats than their actual vote. When we go to Toronto, Greater Toronto, an even more brutal number for the Liberals. You know, even though they had 37% support and the NDP only had 15% support in Greater Toronto, the NDP basically got one more seat with much fewer support. So this is where kind of the targeting and effectiveness of the New Democrats comes into play. And, you know, even in the 905 belt, this is where the conservatives, the progressive conservatives, really shined in terms of their organization on the ground, their ability to deliver their vote, and to really lock down. You can see they basically won 29 out of 20. They won 27 out of 29 seats. With, you know, you can see the Liberals, even though they had more than one out of every three voters, they only got 3% of the seats in the 905 belt. And, you know, it's not much better for the Liberals in Northern Ontario. You can see didn't get any seats, even though they had 32% support. The NDP, and we know the NDP tour went into the north, and, you know, that paid off in terms of converting seat percentages. But, you know, in addition to the 905, Southwest Ontario, another kind of stark contrast where the Liberals, even though they had one out of every four voters, were not able to garner even one seat in that region. And, you know, this is the whole province, and it kind of puts into focus how effective the campaigns were. And, you know, you check out the PC number, you can see they won 2 out of every 3 seats with only, you know, a little over 4 out of every 10 votes. But, you know, that Liberal number is dismal. You know, 30% support, but only 11% of the seats. So what we have to do is remember, and, you know, whenever we're doing polling on popular support doesn't convert into seats. Seats is what's matter. And what's clear is the NDP campaign team has to be recognized for an excellent job that they did at taking fewer voters and very effectively and efficiently converting that into seats. So if we go to my final 3 slides, you can see very simplistic one-word slides for all of you to remember this, so that you have to actually listen to me. Ford asked for an election on a particular topic, and he got it. Trump was really the ballot question, and the focus of the NDP really paid off for the New Democrats and keeping them in the opposition bench. And maybe we can end my slides, and I'll finish there. I'll be hanging out and be happy to answer any questions. Thanks, Avis.
Yeah, thank you, Nick. Before you go, one of the things you said struck me. Basically, and if I'm interpreting it correctly, that Trump had an effect or indirectly interfered with the Ontario election.
Yes, that's one way to put it. I'd like to say he was the uninvited guest. The uninvited guest for Ontarian voters. And you know what? For those that follow federal politics, he will be the uninvited guest in the federal election. And a lot of this has to do with the oxygen. And, you know, what I find is very interesting is that he takes up so much oxygen in the news. It's hard, you know, for Doug Ford, because he's the incumbent and the premier, he gets coverage. It just made it so much more difficult for Crombie and Stiles to get in the news, because, you know what, there's only so much time in a newscast. And when Donald Trump takes up so much time, when in this particular election, the Premier of Ontario, the incumbent Doug Ford, took up time, there just wasn't a lot left for Ford's opponents.
And a quick follow-up on that. The fact that Doug Ford chose to campaign on the Trump issue and sort of push the healthcare aside as opposed to the other parties, do you think the fact that that pent-up demand for action on healthcare might come out to bite him later on in the term? Or is this issue going to go away and be swallowed strictly by the U.S. situation?
Well, I don't think the issue is going to go away, but do you know what, Avis? It's up to the opposition parties to talk about this. You know what? If they decide not to talk about this, then it's not an issue. No one's going to talk about it, and there won't be any focus. You know, what the research suggests is that healthcare is an opportunity to engage voters, and they want to hear about it, whether they're retired, whether they're middle-aged, or whether they're young. They want to hear about it, and they know that something needs to be done. So, you know, the thing is I think we have to recognize that it was a very clever political strategy for Ford to focus on Trump. It meant that he didn't have to talk about anything else, but there's pent up demand to talk about healthcare, and people know that the province is squarely responsible, and they want to hear from all the parties on healthcare.
Mm-hmm. Great. Okay, good points. Thank you, Nick. So with more context, let's go to Michael.
Thank you, Avis. My name is Michael Ceci, and just take you through the political context of what you saw in the election. Obviously, the PCs used the threat of the Trump tariffs and the uncertainty with the U.S. as sort of the cause for the election. Campaigned very hard on protecting workers and businesses, requiring a mandate from the people to do that against potential imposed tariffs. They highlighted making life more affordable and building the, huge infrastructure projects like the proposed 401 tunnel and some of the other rail and light rail projects across the province. On the NDP side, they campaigned largely on their affordability message. They talked a lot about public health care, and sort of tried to differentiate that the NDP is actually for the people, whereas the Ontario PCs have been for the corporations and special interests. And they really tried to brand the Liberals as sort of Ford Light, as you saw, sort of Bonnie Crombie kind of tack more to the center than what Kathleen Wynne or Stephen Del Duca had done. On the Liberal side of things, I think Bonnie wanted to present the party as a very credible alternative to Ford that was a fresh face, less seen as it, in her words, corrupt or beholden to special interests, and really wanted to try to highlight some GTHA healthcare investments and tried to pick up seats there, which they largely failed to do so. And the Green Party, talked about a number of issues and really just sort of focused their political heft on trying to capture a few key ridings, of which they did so in Kitchener. Next slide, please. The NDP remained official opposition due to their very good sort of ground game and their member-held ridings. I think they kind of looked at the board and said, where do we need to sort of shore up our support and where can we go after? Despite the fact that they lost a lot of the vote, they did retain a lot of seats. We had Peggy Sattler, who's the health critic, was reelected. And a new face is Dr. Robin Lennox in Hamilton Centre, who is a primary care physician. On the Liberal side, Dr. Adil Shamji was reelected. We had added to the ranks is Lee Fairclough, a former hospital exec, and I think she works at CAMH right now, and Tyler Watt, who is a nurse in the Ottawa region. However, because the Liberals had so many votes, they are now trying to brand themselves as the people's opposition as opposed to the official opposition. Next slide, please. In terms of the cabinet, there have been none of the members were defeated or did not run it. All the members of the cabinet that have an interface with the healthcare sector ran again, and none of them were defeated. So they're all returning. Whether or not they make it back in to cabinet or at their same post remains to be clear, but a lot of familiar faces around the healthcare and healthcare adjacent sector at the cabinet table. Next slide. So on the government priorities, what we can look to now that the election is over, they're going to be looking at protecting Ontario's borders because of what's going on with the U.S. I think you're going to see sort of the OPP wanting to work more hand in glove with the RCMP and some of the border services agents on both sides of the border to kind of do their part to sort of protect Ontario's border with respect to whether it's fentanyl or other issues. They're going to be doing some work on keeping criminals behind bars and combating hate. On terms of delivering better care and services, obviously there's going to be a big push on primary care. I think all three parties talked about that during the election, and that's sort of something that every Ontarian is concerned about, whether they have a family doctor or not. And in many cases, their family doctors might be retiring soon, or they're moving and they're worried about maintaining a family doctor. There's huge investments in building hospitals and long-term care homes to try to get to some of those targets that they've promised. There's going to be setting aside of large amounts of money, billions, to kind of see what happens with respect to the tariffs and how to support workers and businesses. And because of that, I think some of the other priorities, they're going to be in a bit of a lurch. They can't keep spending or having billions go to sort of what their initial plan might have been before the threat of tariffs, if there is going to be. So there's probably going to be some fiscal restraint while they wait and see. Fighting gridlock will continue with respect to some of the infrastructure projects for both highway construction as well as public transit. And then they're going to really want to step up and work hand in glove with the federal government and some of the other provincial partners, Indigenous partners, to unlock critical minerals and really get Ontario's full economic potential going. And next slide, please. So on the government's priorities for healthcare, obviously $50 billion over 10 years for 50 hospitals. The massive amounts of construction. There's been a lot of cost escalations in the construction space in the hospital sector. So they're cognizant of that. They want to deliver $6.4 billion on upgrading and construction of new long-term care spaces to deal with that wait list and to sort of build in key jurisdictions of growth around the province. Looking at accelerating the expansion of home care services with $2 billion, and $500 million to homelessness and addiction recovery, and then another sort of $140 million to implement Ontario's life sciences strategy. That's what has been promised. That's what they will probably be moving forward with, but there may be some tempering of the actual dollar value when push comes to shove, just due to the threat of tariffs and some of the need for the government to retain some stimulus room. So we'll see how this shapes up in the budget. Next slide, please. A big thing, as I've talked about, is a primary care task force. It's almost a $2 billion investment that's going to be led by Jane Philpott, who's already started into the role. And it's really about just trying to connect all Ontarians with a primary care team, or at least get as close to that goal as possible. And that's an ambitious plan. And so we'll be sure to watch how that evolves over the coming years. Next slide. So what happens next politically in Ontario? We have the election has happened. MPPs are being sworn in starting next week. You'll then have a cabinet swearing in happen. That could happen as soon as the writs of the election are returned. So probably the earliest that could happen is around March 17th. The Premier has already said that he's going to maintain the relative size of cabinet, so we're not going to see a cutback and probably not an expanded cabinet. And then following that, new parliamentary assistants will need to be appointed by the Premier. Right now we have one parliamentary assistant for health, which was Anthony Liardi, and we'll see if they choose to appoint a few more to deal with some of the expanded mandate in the ministry. And then there'll be a throne speech followed by a budget. The throne speech could happen as soon as the last week of March, and the budget could also happen as soon as the last week of March or early April. I know from talking to friends in government that Minister Bethlen Falvey's staff was back at the office the day after the election working, and that his nose has been to the grindstone, waking up at 5:30 and firing off emails, and his staff are sort of in full lockdown mode to kind of get the budget out and over the line. So I think we will see the budget sooner than later as well. And next slide. And just the last thing I'll say before that, same size cabinet. the Premier has talked about increasing MPP pay and creating an all-party committee to look at that. Pay has been stagnant in Ontario politics since 2009, and I think that now that they have, I guess, a comfortable mandate, they want to look at kind of bringing that more in line with being able to attract a higher caliber of individual, and also allowing some individuals that have been there for a long time the comfort to I guess make some more money so that they can move out of government and not want to sort of stick around for too long. And lastly, I just would say that the voter turnout was actually up slightly from the 2022 election, which is pretty pretty remarkable given the fact that this was in the dead of winter and there was a lot of seeming lack of interest. And lastly, what I'll leave you with is, as with any electoral cycle, after a new election and a new sort of MPPs are sworn in, new cabinet, often a lot of same faces. There's a lot of staffers in some of these key ministers' offices and all across the government that will be sort of naturally leaving and turning over. So there's a great opportunity, regardless if the ministers stay the same, to make some new connections in government and reintroduce yourself to key people in government in many cases.
Yes. Great. Thank you very much, Michael. Quick question. Given that what Nick told us about the demand for healthcare changes and improvements in services, and what you're seeing, I'm just thinking of all the patients waiting for care and the hospitals and the ERs. Do you get a sense that the government will commit to the improvements that they've agreed to, despite the potential budgetary issues coming, or is there some sort of risk? Because there's a lot of unhappiness out there that Nick identified that could be at risk. Question.
Sure, I certainly think on the the primary care side, they really want to drive that forward. In terms of some of the other things, there may be some tinkering around the edges. Obviously, no one can accuse Doug Forder's government of being a fiscally conservative government, so I don't think the risk would be as great if, let's say, Mike Harris was premier. However, all that has to be taken into the context of the fiscal framework. However, if there is a regulation change or an ability for additional participation from the private sector that would help them to achieve their goals and expedite some of these goals that they have in the context of some of the fiscal challenges, I think they would be very open to that. But at the end of the day, I would not be surprised if additional monies were spent with the tariffs and into healthcare as they had initially planned.
Sorry, more or less? Less?
I would not be. On one hand, I think they have to live within the fiscal framework that they're given, but at the same time, we've seen this government in the past just kind of blow through those guardrails and continue to spend money largely it doesn't add up to what a typical conservative government would do, and that's why
maybe
it's
responding to voter demands for
yes, exactly,
attention on this. Okay, thank you very much, Michael. And okay, now back to the correct order. So what comes next? Looking at how the election might affect the government decisions on health spending, we go over to Patrick.
Thanks, Avis, and thanks, Michael. So just to take you quickly through the life cycle of most governments and how they think. Of course, this isn't just the Ontario one, but we'll put a hyper focus on Ontario. So we've got this laid out into 4 clear years. I think realistically we can condense them into 2 phases. And Michael started talking about that. In the early years, governments by necessity try hard to hold money back. They try to make their tough policy decisions early, so that they can get them in the rearview mirror for the 3rd and 4th year, or rather the second phase, where they really start to focus on putting fires out, making good on commitments, and moving quickly into making big announcements and reinvesting again. I think if we think back to the last Ford mandate, elected in 2022, The first 18 months were really about pushing the reset button on a number of COVID budgets, or perhaps better phrased as moving past COVID. Whereas year 3 and 4, albeit condensed into 6 months because of the early election call, but they did really work hard to wipe the slate clean as much as they could when it comes to healthcare. As Nick pointed out in a different way, they didn't want to run on healthcare. And that's not abnormal for incumbent governments. Incumbent governments tend not to win on healthcare because it's near impossible to make the electorate happy. But they certainly found the sandbox they wanted to play in, and they played well in it. When we think about the things that they tried to move past, they provided funding to kind of put Bill 124 and their wage restraint bill in the rearview mirror. They got their 1-year deal with docs, mandated or not. They were able to move past that. They made some big changes to deal with home care delivery. You might recall that was a big fire that was burning in the fall. They were able to put that behind them. They made a pretty big announcement to hospitals that wasn't announced in a public way, but that was an effort to move health off the agenda. And of course, Michael talked about the big investment in community care and the announcement of Dr. Jane Philpott, which of course didn't solve all of the issues in primary care, but it certainly gave them something to talk about when it came up through the election. So all of that said, I think we're expecting that generally the themes in that first phase that I talked about and the second one will stay as they are. Of course, austerity or budget restraint is going to be difficult if they're spending on things to respond to Trump. But I think we're expecting that they'll put a focus on, if not on all of their budget, but rather the operating budget for health and social services in particular. And then as we get closer to the next election in 2029, the years preceding that, they'll start again to think about how do we make the problems go away? How do we make the issues that matter most to Ontarians, in particular in healthcare? How do we put those to bed so that we can run an election and not be hyper-focused on health? Next slide. So if we think about key takeaways, and then we'll get to a discussion. Ford has a clear mandate to deal with the fallout from Trump. And I'm not referring to the majority and the 80 seats, but rather directionally as a government, all eyes will be focused on our neighbors to the south. This will be the new government's priority for the foreseeable future. When we think about a federal election, oh no, another election, I think this focus is going to be only heightened. As Nick put it, Trump gets the microphone and he holds it. So that combined with our federal election is going to be a big distraction for the electorate, and of course for politicians at every level. And maybe some good news for our health community listening as it relates to influencing government. Nick confirmed the electorate cares, and they're still seized with the need to repair our health system. So I think we can expect, whether behind the scenes or through the opposition, those issues will continue to burn. And even if they're not on the front burner, I think the government will be forced to make some big changes and investments. A crisis often leads to big changes. So we can, of course, expect, and I think we're seeing already, that changes are coming as it relates to attracting business to Canada and keeping business in Ontario. Lots of talk about interprovincial trade barriers that we expect would be removed quickly. But I think crisis can also mean the potential for change in other areas. So with the spotlight on other big things, Trump stealing the news cycle and the spotlight, I think there is an opportunity for government to make more substantial changes, in particular in the health system, and be more open to big thinking and big change. The last one there, it's easy to forget that pre-COVID governments were focused on health, weren't focused on health or on the health workforce. I think that was clear and became perhaps alarming through COVID. Through COVID, there was no absence of funding available. whether it was from the federal government, from the provinces, albeit perhaps more episodic, there was funding, and more for more was acceptable. And what I mean by that, spending more money to get more activities was an acceptable thing to bring to the table. But I think with budget restraint, and if we think about before COVID, the framing of things was more about how can we do more for less or more for the same. So how can we spend less and get more, or can we spend the same and get more? So I think when we think about framing to government, I think that's an important thing to focus on. And lastly, this crisis will pass eventually, maybe in 2 years, but at some point in time, the politicians again are going to focus on healthcare. It will matter to them. It will continue to matter to the electorate, as Nick pointed out. So politicians of all stripes are going to be forced to talk about healthcare again, and to make some big changes to fix it. Thanks, Avis.
Okay, thank you, Patrick. It's nice that you're optimistic that this crisis will pass, because right now it feels like it's never going to go away. Anyways, okay, we have some questions, and I'm going to first continue on the election issue with some of the questions, then we'll move to tariffs. But we have one question from someone who's watching. That question, it might go to Nick. What is the potential implication of the election Ontario Liberal Party's performance on the upcoming federal election? Do you think it will have any, how the Liberal Party performed in this one having an effect on the federal campaign for the Liberals?
Yeah, I'm not sure it's directly comparable. I think they're going to be two discrete events. First of all, because you had Doug Ford call the election. He was an incumbent looking for an even stronger mandate. I think it probably has more implications for the New Democrats. Look, if you're Jagmeet Singh and the New Democrats, you're probably looking at what Merritt Stiles did, and it'll be like, hey, maybe we should try to do something like that too. Like they took a lower popular support and they were able to convert that into seats. And I think it has significant implications for the New Democrats strategically. For the Liberals, it's going to be different because they'll be coming off a leadership race. This weekend they'll be selecting a new leader. I think one of the key factors is how big or how little a win it might be for the winner. If it's a big win for the winner, then the Liberals are going to look united. And they're building off momentum. Like, it's not like Bonnie Crombie and the Liberals had momentum going into this campaign. The federal Liberals, well, why don't we just say that they are more competitive than they have been in 2 years, right? Doesn't mean that they're going to win the election, but I don't think there's much of an implication other than for those opposition parties, the Liberals and the New Democrats, to think, how can we convert popular support into seats, and who's got the best ground game.
Okay. Okay. The next question might go to Michael. I think so. Is the $28 billion investment over 3 years to expand home care services incremental on top of the already announced $2 billion?
No,
Sorry,
no,
$2 billion. I'm reading on.
I think it's just a restating of what they announced in last year's budget, and just sort of highlighting that they're still spending that money. So no, it would not be incremental.
And this is healthcare, Ontario Healthcare at Home.
Well, just in terms of funding for home care.
For home care. Okay. The next question. The shift from community-based mental health care to Heart Hub and potentially involuntary treatment is a significant shift in the approach to homelessness. Is the lack of designated funding for mental health services a sign of things to come? Michael?
That would be hard for me to speculate on. I'm not sure, but I'm happy to take that back, and if we have your contact information, reach
Sure.
back to you.
Okay. Yeah,
I'll just jump in and to your point, Avis, I'm perhaps more optimistic on most things. It's how I get through the night, but I don't think the fact that they didn't hone in on mental health or funding for mental health through an election doesn't mean that there wouldn't be investments. But they made a conscious decision not to showcase it, which is a very different thing than thou shalt not fund it in any meaningful way. I think when
Why
I've
would
talked.
they do that? Why would they do that? Why wouldn't you want the public to know, yes, we're making this a priority and we intend to do it?
Well, I think you pick lanes where you feel the most comfortable through an election cycle. I think there's some great vulnerabilities in mental health and addictions. They made some big policy changes that they felt vulnerable on, but comfortable with. So shining a light on something, putting a bullet in your platform sometimes means the opposition have a place to speak or critique it in a different way than they would if they didn't. I can't pretend to know all the things, but I only to say that just because it wasn't highlighted doesn't mean that there isn't an opportunity to make policy recommendations to government and to influence them to make decisions. I think the whole healthcare system is seized with lots of things. One of those things is the inability to access mental health treatment quickly and close to home.
Yeah. Okay, let's move to tariffs. Uh, it floors me how chaotic this whole discussion is, but do you have any sense on how worried we should be about tariffs on the healthcare system? The budgets are tight. The hospitals would have to absorb a lot of its costs. What's your sense of what kind of an impact it would have on the healthcare system in Ontario?
Uh, in terms of, I know that right now, although it's not sort of an express mandate, the ministry and minister's office staff is looking at by Ontario or by Canada, if there's an alternative for supplies or whatever is required for new equipment in the healthcare space, as long as it's as an alternative does exist, and as long as it's not prohibitively expensive or going to result in worse outcomes. So I know that obviously you've seen the premier signaling that right across the board, and the healthcare sector is no exception. I think it'll all depend on, are the tariffs actually going to be on? Will there be carve-outs? Will there not? How long? But they are actively looking at this in the healthcare sector and all other ministries from a procurement perspective.
It is hard to tell because there's so much that does come from the United States, but there's a lot of production in Canada that we can take advantage of. Okay. Another question from Doug Earl. Almost all of the healthcare supplies used by Ontario's health system are manufactured in the US or elsewhere, not Canada. Counter tariffs by Canada could impact budgets. Are they targeting counter tariffs on these supplies? And does anyone know if the Ontario government is planning to spark a new health care made in Canada initiative, kind of across to some of what you've answered? But Michael, Patrick? Yeah.
I could maybe add to what Michael has said already, that I like, from my lens, they have taken a very surgical approach to the counter tariffs. So what are the areas where we can absorb or make different decisions? I think it's incumbent on the healthcare community to raise those red flags now, so that governments don't make a decision that's going to have a negative impact on our overall costs and supplies. I think what we saw at Ontario Health at Home in the fall, I do think there's a renewed or a refreshed understanding of that supply chain and how it works. So my guess is that would translate into being very careful and again surgical in how they apply those counter tariffs.
Mm-hmm. My understanding is that whole debacle is not solved yet, and I happen to have a family member who was getting home supplies, and he was not getting the right stuff that he needed after a fairly serious operation. So that is an ongoing and very learnable lesson on that one. Just one question about the tariffs. Nick, do you think that the tariffs and the fear of what they might do could derail healthcare being the priority that the consumers want it to be, that patients and healthcare workers want it to be?
No, because it's never going to go away. It's just not going to go away. And the thing is one of the things we haven't talked about is, if something, I know Patrick's optimistic, but why don't I just say, if something bad happens, on the healthcare front. So it'll go from a latent issue to it'll be like an open wound. It'll go from a latent issue to kind of something that really creates a lot of political pain for politicians who are not not ready on this. So you have to think of healthcare as kind of like the percolating issue that if something goes wrong, it'll go from like 20 to 50 really fast, because people already know that we need to focus more on healthcare and we need to have solutions related to healthcare, and we have to do things differently related to healthcare. So, you know, we have to think of you know, the tariffs as just another new risk on healthcare in Canada, in Ontario, in addition to all the other stuff that's already there. So you have to think of people going, oh man, now I never thought of that way. But then it's just one of those things, like to the question from Doug in terms of the impact on cost, you know, people are now just starting to realize the potential cascading negative impact of tariffs, you know, not just in buying consumer goods, but on health services. So
health services and everything
medicines,
from implants,
all that stuff.
medicines.
Yeah.
Yes, I mean, it's crazy. Pharmaceuticals, like, we don't even know about that. You're right. So no matter what happens with the tariffs, what your bottom line is that the healthcare issue is still going to always be there, and they have to watch and answer to the public.
Yeah, and the need. And the tariffs will exacerbate the healthcare issue, because now people will be thinking about affordability and all that kind of stuff. And you know, we could even get back, Avis, into where we were during the pandemic, where we are talking about the supply chain. We start talking about the supply chain. Well, we haven't been talking about the supply chain since the pandemic. That could come back in terms of how resilient Ontario is on the healthcare front, just in delivering healthcare.
Do you think that since the pandemic, you have seen action on the supply chain in Canada and Ontario?
I think people haven't seen it in the news. It's like everything. They go, you know, I remember we were doing focus groups, Avis, and someone said, well, they're not in the news, so it must be okay. Right? It doesn't mean that it is okay, but
No.
it's just not in the news. And I think, you know, for average Ontarians, it's kind of like, you know, if journalists do their job and focus on the issues that, you know, their readers want to hear about, they'll put a spotlight on this.
Nick.
No, that wasn't a shot at you. That wasn't a shot at you,
don't
Avis.
worry.
I'd just like to say, because I know you're the expert on all things health.
No, hardly, but it is very hard. And the problem is that the data is showing that people are not watching the news because it's exhausting.
Yeah.
And it's this array of material, and it's all decentralized now. So people are taking holidays from the news at the very time that they actually do need to understand these things. So that's why I encourage, you know, people to tell their own stories, because it's got to get out there on other platforms there. But so, Patrick or Michael, do you think that this is an opportunity for the province to invest in more made in Ontario medical supplies and devices? Do you see that as a possibility, Michael?
Well, go ahead,
or
Michael.
Patrick? Yeah.
I don't know that, like, when you say invest, like, certainly they'll be looking for opportunities to, you know, partner with such organizations. I don't know that they're going to invest to create or spin up you know, new companies.
Encourage, encourage.
But it certainly will be something that they'll be looking at to try to do. Like, I don't think you know, if you can buy medical gloves from a Canadian manufacturer at about the same price as American, they're probably going to go with the Canadian manufacturer. However, you know, conversely, like, I think if there's a American pharmaceutical company with a large manufacturing presence in Ontario or Canada, I don't think they're going to, you know, kick them out or anything like that. So it really does depend.
Yeah. Patrick, did you want to add anything? Otherwise, I'll go to the next. Yeah.
You can go ahead. Go ahead.
Okay, next question from Matthew. With a reduction in provincial trade barriers, do you see any room for greater interprovincial collaboration on issues like professional credentialing? I think that is already happening, but anybody want to take that on? I saw some announcement yesterday.
I
Wow.
think the answer is yes. Sorry, Michael. I think this is a 20-year-old conversation. I was at the OMA for 10 years. It was a conversation when I was there. I think there's been big movements. I don't think it's going to solve the health workforce problem by a doctor being able to practice faster in another jurisdiction or take your pick of any of the other providers. But national credentialing's an important issue, and I think
Mhm.
this will give a focus perhaps to it.
Okay. Um, I am heartened by a small story, a little trend that I picked up and did for CTV, and that is the crisis and the tariffs and all of the changes in the United States are prompting more physicians in the United States, particularly female physicians, to look at moving to Canada. So at least two, three, I know have moved, and there are a bunch more that after we put the story up, it was quite surprising to see how many are willing to make the jump. Now, this question from Candace Chartier. Requests for proposals are coming out already with guidelines that consist of Canadian only products and services. Do you think this is going to impact human health resources as well as supplies in healthcare, specifically impact on some virtual care products? I don't know exactly what that means, but who wants to take this?
I mean, I think if there, if that's what the RFP states and that's coming from the Ontario government, I presume that that will be the, what they're going to be looking for, at least in the scoring, how they sort of rank some of these responses to the request for proposals. That'll be weighted more heavily in the ranking. I'm not sure what specific sort of virtual care products you're referring to. If that's sort of someone outside of, in the US
Yeah.
providing some form of virtual care. Again, I think it'll also be through a lens of, is this going to have a neutral or no effect on the quality of care or service provided, or is this going to negatively impact? If it is, I think they'll be less likely to go to another option if it's worse, just to keep it in Canada. But again, I think it'll be on a case by case basis, and certainly the weighting now will likely change to reflect sort of a made in Ontario, made in Canadian
Mm-hmm.
solution more heavily.
Mm-hmm. Patrick.
Just to make the point, Michael touched on it before, but there's a very sort of black and white on this issue, and Kentucky bourbon's like the simple one. It's made there, and then it's shipped here, and the people who make it are hired in the U.S. and live in the U.S. I think there's also a gray zone where it may be an American company, for example, but if we're talking about Canadian employees, Ontario employees, if it's manufactured here, I think there's a gray zone that if it isn't being contemplated now, it will be contemplated really quickly. And Michael raised the sort of pharmaceuticals that are manufactured here, like that's and the other one big one that sticks out, which is more germane to the bigger conversation, but um, most of the big car companies are in fact American companies. But if their auto plants are here and making cars here, and the employees are living here in Ontario and Canada, like we're not talking about shutting down those plants, right? So there's a gray zone, and then there's a very black and white, I think.
Mhm. Okay, great, thanks. Well, with 5 minutes left, what I'd like to do is ask each of you for your take-home message. What is it that you want people who are watching to take home about the new Ontario government, which is the old Ontario government, what they're up against, and where healthcare is going to fit in, because that's what people want with all of these. Let's start with Nick. You want to start first?
Sure, absolutely. Um, am I supposed to annoy people, Patrick and Avis? Anyways, don't listen to politicians, and what they say is important. That's basically the key takeaway. And to say that this is an issue that cuts across generations, it cuts across gender. It's not sexy, but the thing is, it's an issue that people want to hear about. And the other thing is that I'd always kind of say that we've done polling on healthcare issues for like 30 years, and people know that the system is complex. They're suspicious of anybody that says that they have a simple solution, and they want to see little bits that are improved and made better. So maybe one way to think about your approach on healthcare is not about engaging the government and saying you're going to boil the ocean. It's about, you know what, here are 3 things that we can make better, and to kind of have that approach, and that when politicians say, oh, you know what, we know that healthcare is important, but we're dealing with other issues, you have to stop and tell them, no, you've got to get ahead of this on it.
Very good advice. I like that. Thank you. Michael, you want to take a shot? Key message.
Sure. My key message is just to, ensure that you are properly engaging with government in the language that this government speaks. That means sort of going along and move, like following the government with their mandate. Their mandate now is sort of protect Ontario. It's all going to be colored by this tariff environment. Maybe change some of your language, try to offer proactive solutions to government to either help them reduce regulation, to make whatever it is better for Ontarians, if that's healthcare, home care, primary care, whatever it might be. And don't be afraid to offer sort of out of the box solutions. It's just about sort of meeting the government where they are.
Good. Okay, thank you. And Patrick, final word.
Thanks, Avis. I think I'll repeat a little bit. A crisis is a great opportunity for change. COVID was a crisis, and lots of great things changed in our health system and elsewhere. I think the challenge through COVID was that the focus of all of us, including our politicians, was on healthcare. And sometimes in our health system, the biggest obstacle to change are those who scream the loudest on why the status quo should never be different. So I think with this crisis and the focus on Trump and other things, there's an opportunity to make more changes, to bring innovation to the health system that might not exist in an environment where everybody is watching closely.
All
So
right, thank
change,
you.
let's get some things changed and bring some more innovation to the health system.
I guess it depends on what the changes are, right?
Well
Right.
said.
Right. Anyways, we will wrap up with that. I want to thank all of you for joining in today and being a part of this. And thank you to all the members on the screen today. A copy of the webinar will be posted on the Santis website, I believe, later today. And on behalf of the team today, please have a great afternoon and try to avoid the chaos going around you. Thank you all for watching.